Hello. Um, Thank you for joining this session. My name is Lee Gutcher. I work for the NHS for North Central London ICB. So I've been asked to give a brief overview of the NHS, if that's possible, and different access routes into the NHS. And then I think I'll hand over to Shafi, and then perhaps maybe we can answer some questions at the end, if that's okay. So the NHS. I'm going to be controversial right from the start, and I'm going to say, put a big red cross through the N. So for me, currently, there is no National Health Service. Why do I say that? This is the current landscape of England, and all these organisations here are all NHS trusts. So show of hands, does anybody know how many NHS organisations, how many NHS trusts there are in England? Can we have a range? It changes all the time, so I might have even got this wrong myself. Thousands, 180, 180, 200. It's 229 NHS organisations or NHS trusts. Another way of looking at this is 229 individual companies that work within the NHS. Every company or every NHS trust has its own individual CEO, its own hierarchy, its own culture, its own budgets, its own approval processes, etc., etc. So one of the big misconceptions I always hear is once you've accessed the NHS, then you can scale out easily, but it's not quite as easy as that. So that's the first takeaway point, I would say. The next number is the number 42. Does anybody, I think I heard someone say it, but does anybody know what 42 is in relation to? ICBs. So integrated care boards. There is 42 of these throughout England. They were introduced in July 2022. And it's over 7 different regions, which are the different colours here. And the main aim of integrated care boards is for all those 229 NHS trusts to start working more collaboratively with each other and also working in partnership with each other as well. So we're now getting to a point where we're bringing the national back into the NHS and starting to centralise things. I mentioned I work for North Central London Integrated Care Board, and that's where we are, number 25. It's like playing bingo. And I feel really insignificant. Very, very small, but we have 10 acute trusts within my ICS, including the Royal Free, UCLH, Great Ormond Street Hospital, Moorfields. There's some huge institutions within that ICB. You, Shafi, will work in a different ICB to myself, and Barts, I believe, yeah, which is another huge institution within London as well. Okay, so the NHS, this is my visual interpretation of the NHS and how it interacts with healthcare suppliers. What we're facing at the moment is something that looks like this, times 1,000. Lots of different healthcare suppliers and entrepreneurs who are all trying to access the NHS, and it's all going down this thin funnel at the bottom. But I think that there is routes into the NHS, and there's 3 which I'm going to talk about. Once you've accessed the NHS, it's not a given. There is obviously a road and a journey to go on as well, which will also, we can talk about as well. And I can give you some advice about how I would approach the NHS. So let's break these 3 avenues down. So firstly is through the advocacy route. So exactly what you're doing today, going to different conferences, building relationships and partnerships up with NHS professionals who are also at the conferences, building relationships with with consultants, with NHS leaders, and obviously trying to access the NHS via that route. And I've got a story which I'm happy to share afterwards about a particular company called Organox, who implemented their liver perfusion technology at the Royal Free Hospital via this route and those personal relationships as well. So happy to share that afterwards. It is possible. Shafi, you might have some examples of this as well, which obviously you can share. Also as well, is there any Bulgarian consultants, for example, who are working in the NHS? Could you build some relationships and partnerships up with them, accessing their organisation, running some pilots, etc. And that's one way of obviously growing your product within the NHS. The other two are more formal. There's the formal tender routes or competitive tenders. There is something which is called the G-Cloud 13 framework, which if a supplier is on this framework, the NHS can directly award to that organisation. So that is something to look into. One of my programs is in procurement. I'm not a procurement expert. I'm still learning myself. And this might be something that I will look into a little bit more about how you actually get onto that framework as well. Every tender which is published in the UK is put onto the government website, the contract finder. So if you've got technology which is in the field of radiology, you could go to that website, type in radiology and see all the different tenders that are available under the umbrella of radiology or any other specialty. So that's another route through as well. And then there's different accelerator programs. I'm sure there's more than just this. I've just learned upstairs that there's the Accelerated Access Collaborative through NHS England, which I'd never heard of before today. But the two which I am aware of and quite popular is the NHS Innovation Accelerator and also Digital Health London, which is an agency which the NHS uses when it obviously needs suppliers of technology. It's a trusted agent that the NHS use. So those are the three main routes into the NHS, and there could be more, and we can discuss those as well. Okay, so obviously I mentioned about the journey once you've got access. There's three things that I would mention on this, and it's almost like a hierarchy of needs. So once you're in front of someone from the NHS, once you're in front of that consultant or a tender panel, etc., I think if we look at this as a hierarchy of needs, I think the first thing I'd say is that the NHS is extremely risk averse. It wants to innovate, but it's very slow to get things moving. And I think one of the things that I've picked up on is NHS organisations don't like to be too risky. They don't like financial risk, they don't like risk to patient safety, they don't like risk to their reputation, etc. So I think the first thing that needs to be done is to give that assurance of that the product that you're providing is free of any risk or minimal risk. I think the second point after that then is having a common goal. And the three things I would say on this is in the NHS plan and objectives is number one is to recover services and reduce the backlog, obviously after the pandemic. There was a backlog before the pandemic, I'd just like to mention as well. It's always been quite big, but it's exceptionally big at the moment, so that's the main priority. The second point I'll say is there is an NHS long-term plan which is being stuck to. So I'd encourage you to look at this document. It's a white paper, read the document, and any aims and goals of your organisation and your startup or company, try and link it to the NHS long-term plan. So things in there is more integrated care, population health, reducing cancer rates, etc., and also transforming the NHS electronic patient records, all that kind of things. There's lots of things in there. So obviously link your organisation with that and have a common goal. And then the third point is transform for the future, which for me that's 4 words, which is linked to the long-term plan. But again, it's modernising the NHS as well, which again, we're all working in the health tech space. So by definition, it is modernising. And then, I couldn't think of another word, but then exotic. Then I think we're really happy to hear all the amazing things and sexy things that different products can do. But and it's great, but I think we need to get the assurance and the common goal, get those cemented in first, and then start developing the vision with the NHS after that. So that's all I've got for now. If anybody wants to connect with me, then you can. I'm on LinkedIn and also happy via email. I think I'll hand over to Shafi at this point, and then perhaps maybe we can do a Q&A afterwards. Sure. Yeah, thank you.
Okay, so I guess the question really is having to navigate the NHS. So at Giant, what we've tried to do this year, we've been around for 7 years. This is our 7th year of Giant. We started as a conference to bring innovation into the NHS, to bring all the right parties together. That means medtech companies, innovators, VCs, startups, and the NHS providers, ultimately who are the people who pay the money for some of these solutions. NHS is quite difficult to navigate. There's so many different systems in place, whether it's the NHS England, for example, as an overarching body, the new ICS. So the ICSs, for example, the 42 integrated care systems are new. They only came into being in April of last year. They're still trying to figure things out. Okay, we've been through at least 5 reconfigurations in my lifetime. Okay, this is the 5th one. All it means, more money gets spent to reconfigure something, and we're not sure what the output's going to be at the end. It's one of those things we go through. But as I say, as the ICS is now being reconfigured, it's also an opportunity. While they're trying to figure out what they want to do, how they want to bring innovation in, that's the right time to have these conversations to embed yourselves into a system. So I think it's an opportunity as it's a bit chaotic, as we're trying to figure out what it means. So that's one advantage for it. I think in terms of bringing things in, how would you go about having an idea, because this is the question, into the NHS to be able to, A, get it used into a system, secondly, to create a tariff or reimbursement model, and they're two kind of separate things. The UK is very good, and it's very good for pilots, 100%. You want to bring a pilot in to work with a partnership, a research partnership, it's straightforward. There's funding available, grants available from either universities or Tech UK or Innovate UK. There's grants available. And that's actually quite low-hanging fruit. That's the first step in the process. You get validation, you bring it in, you have a partnership, and we have something called the AHSNs, the Academic Health Science Network. And these are universities working in collaboration with healthcare system to allow you to do the research validation. So that's the first kind of step. And they will have startup areas, they have innovators, they have accelerators, each one of them will allow you to come in. So those are kind of the first steps of bringing something in. And then the question, of course, is how do you, once you've got a pilot, it works, how then do you scale? How do you bring it more into a kind of wide adoption? In fact, Raj was speaking earlier on our panel here about going to NICE directly. So NICE is our kind of National Institute of Clinical Excellence, and you don't have to have full validation for NICE. You can go with some ideas. So I'd like to bring this idea in. They don't always need validation. They realize the urgency of technology. They realize you can bypass and bring things much faster. Actually, having a nice conversation with NICE is actually a good thing. People think you have to have all the evidence ready. You have to be very ready with C kite marking and all the validation with controlled trials. No. Have a chat with them early. See what they need to adopt. And they may say, actually, we think this is urgent. We will help you bring it into the UK. Similar to the MHRA. The MHRA is kind of bringing medicines into the UK. Again, have a similar approach now. They've changed over the last few years in fostering that innovation into their system. Prior to that, laborious, bureaucratic, difficult. So all these things are now, I think, much easier to come through. The other thing that I want to mention is that some of these companies to come in, so the Crown Commercial Service, so the government has a Crown Commercial Service, and you mentioned the cloud earlier, and they allocate so many companies to allow them to bring companies into the government. The government procure through these Crown Commercial Services. And I just discovered more recently, one of the partners was here yesterday actually, so they've tendered for healthcare innovation already. That's been allocated, 1, 2, 3rd group. He's one of them in the group. And so he's looking for companies now to be into his tech vertical, in which case the government can procure directly through him without any further instructions. As long as you're on his books as a tech company or providing a service, the government will see it and will directly get you to have a contract. So I think that's one real option available to you. And I'll share his details with you, by the way. Yeah, if you send me an email, staff, I'll introduce you to Amri, his company. And there's about 150 providers like that which you have to go through to work with the government. Yep, it's like central procurement. They use that for COVID, to bring in COVID supplies, COVID medications, vaccines, all through the same framework. And the budget for the Crown Commercial Services next year is 1.2 billion for healthcare. Okay? So it's a huge opportunity for you guys to think about getting involved with your companies and being accessible. He's looking at AI, immersive technologies, XR technologies, wearable sensors, for example, as well as medicines, etc. So it's quite a broad spectrum of technology. So I'll share that with the details, and please, I'll share his prospectus with you and get involved, get your companies in there ASAP, because now's the time. Because you've got 4 years to get that thing in to make sure you're profitable within the NHS. It's worth a go. So that's kind of all I was going to say, a few things, but more importantly about Q&A, because NHS is so complex, so difficult to navigate, is how can we help you? Also, and perhaps Lee wants to come up as well, and have to have a Q&A. I think that's really going to be valuable, because there's so many things we can talk about, but I'm not sure what's going to be helpful to you directly. So feel free. Do we have another microphone? Yeah, we have another microphone. So we'll hand that around, and just feel free to ask questions. Have you enjoyed Giant so far? It's been great. It's been good, isn't it? So look, we've been 7 years now. When we first started, let me tell you the story. When we first started, we thought we need to do something innovative and build something. And we had our first show in a place called the Woolwich Coronet. It was an old, big theatre, long, big theatre that was disused for many years. Cold, no heating, horrible. And in fact, all the people that used to walk around on that first day, the feet would get stuck in all the beer on the floor. It was sticky, and they'd walk around like this. It was horrible. But you know what? We had one AV guy. So we ordered AV, and a 16-year-old boy turned up with a computer. That was AV. Honestly, that was it, right? So it's okay. And it was, it was very chaotic, it was shambles. But people loved it. People thought, really edgy, it's different, and we were forgiven the first year for being so unprofessional. But we kind of managed through that. We kept building the program, saying, what do we do? And it's really, this is the perfect scenario. Helping you guys understand NHS, understand innovation, how we bring you in, how we connect you and collaborate with the people that are in the same room together. And so that's kind of where we are now. And now this year, it's our biggest conference ever. It's the biggest medtech event in the UK ever. We have over 3,000 people registered, probably 3,500 now. And so for UK, that's a big number, right? I know I've spoken in Bulgaria many times for Plamen Rusev at Webbit, and that's like a big 20,000 auditorium, right? We can't compete with that, right? As is much smaller and concise. But I hope you found it useful, at least to network and find people. Yeah, any questions? Go for it. We have another microphone?
Yeah, do you want me to?
Yeah, sure. Between us, we'll manage it.
Who's first?
Any questions? Go for it.
Hi, thank you for the presentation. Do companies need to have a UK entity in order to participate in that framework or whatever?
No. They take, so the companies coming through are Canon, Olympus. They're major companies based out of the UK, small or large. But get into that framework. It's a real simple win for you, right?
Okay, so Brexit, etc., that
doesn't matter.
Affect
No.
that.
Government will go and get services. Government will procure you through these entities. It doesn't have to be a UK-based company.
Okay, thanks.
Yeah, sure.
Hi, thank you for this opportunity. So what is the minimum requirements that a company need to have in order to apply? Like a revenue, years of existence, previous services provided?
Zero. No. You just show you have a platform service that works. You push that onto the Crown Commercial Services. As long as it's on the framework, they will go to you. So you may say, I don't know, you might be doing XR technology. You create the technology behind it, maybe, for example, and you show the case that, and they know that you have your company, of course. You have to have your company details. They'll do a bit of due diligence, but not a huge amount of due diligence. They won't be going into your record and saying, well, are you profitable or not? No. It's, yes, are you credible? You have a company. They do the usual government due diligence, okay? And that's it. And then once you're on the system, they will procure, if they need this technology company, they'll come and find one in the framework and just go to you directly. So they're allowed to do that directly. And they're the only companies allowed to work through the government.
So you apply on the G Cloud?
Yeah.
You get procured.
Yep.
You get into the list.
Yep.
And once you're in the list, if they're interested about your services, they contact you.
They contact you directly. Through one of their partners. They'll say, we're interested in that person. They'll come through the framework partner, and they'll just allocate you directly. Yeah, it's the way I didn't realise. Only recently I realised this is how the government buys procurement commercial services. Yeah,
That
it's a
sounds-
complete. I had no idea, but this has the secrets. All the major companies, they're all on that framework. Every single one, Amazon, you name it. And the government will say, okay, I need this. Let's go to this provider. We'll get him directly. They'll give you a phone call and you come in. Once you go into the system, it's the
But
easiest
if you
way.
have so many companies, what's the criteria for choosing the right one?
So that's another good question. So obviously it depends on the managers at Crown Commercial Services, who they support, who they work with. There's a bit of a relationship thing there, as you can imagine. So I know the guy that I work with, he's got great relationships. He was Theresa May's advisor. So clearly the government will work with him. And he provided a lot of the COVID stuff during COVID. So he's a preferred provider and reliable provider. So once they're happy, they're reliable, they will start coming to the right same people every single time. Yep. Although you may have 157 of them, actually they'll only use very few because they have that relationship. It's all politics, it's political. If you're in the government before, advising Theresa May and the government during the last 5 years, you're going to have access, right? It's how all governments work, right? Ivan, at the back. Ivan.
Oh, Ivan.
Ivan, did you get my pictures?
Yes, I did. Thank
Good.
you so much.
They're great pictures, right?
Nice pics, yeah. What would be like the good practices that companies should be aware of? How can we increase our chances of getting selected or making the right contacts in NHS? Any good practices?
That's a really good question. I think it's about relationships, number one. Wherever you go in the world, it's having a relationship with people, having discussions, but also knowing how to navigate through the system, right? You can just come in blindly and say, I want to bring my product into the UK. And you're stuck, because who do you go to? Who are the right people to help support you? And that's going to be the key. It's that relationship. We know the HSM, we know him, for example. Let's put in touch with them, for example. You need that always intermediary to know where that platform, that technology, that solution is best served and the route around that, okay? Otherwise, you'll go around in circles and they will just dismiss you. I think it's about relationship building, isn't it? Having somebody who can introduce you to the right people, who knows who will help you to navigate and to bring that first conversation, yeah? Rather than just blindly sending an email saying, hey, I'm from Bulgaria, I've got this great tech, will you help us? The answer is no, right? It's a relationship, hey, I've seen these guys, we've worked with them before, we know this group, can you help them? Also, working as a group, I think you're very powerful as a group, right? 100%. And actually, as a consortium, I've seen a number of companies like from Estonia and others who have a consortium. They come as a group. Hey, this is our group we have. How can we bring more of our work into you, the technology side of things, Ivan? That's great. It's not just one person. It's a whole group of people bringing technology together and solutions. So that's also another option for you. Yeah, there are. Yeah, really good question. And I'm sure he will tell you those. There's a couple of events. NHS Confed. NHS Confed is NHS only, right? Everyone from the NHS comes along, all the major companies come along and exhibit, and all the providers, the managers, the decision makers are all there. It's once a year in September, October, up in Manchester usually, NHS Confed. So look at that one, and you must come to that one. There's the HET show, H-E-T-T, but again, they're NHS-y. But NHS Confed is the biggest one, I'd say. What are the others, Lee? Do you know any more?
There's NHS providers.
Yep.
Yeah, it's every September. And then there's the health tech show, which I think...
Is that the HET show, is it?
No, that's...
Rewired, yeah. So there's
Yeah.
Digital Health Rewired, again, has all these. So if you've got... So Digital Health Rewired is another one that's quite popular. It's aimed at the CIOs and the CCIOs, the Chief Information Officer and the Chief Clinical Information Officer. So they are all together at Digital Rewired. It's very specific for them. So if you want to access that kind of information, the technology side, the kind of the data side of things, those are the right people. And they are also decision makers. They're C-level executives at every hospital. And they all come along. And it's very popular. Digital Rewired. And they've copied us. They've come here. They have their conference here in the Angel. NHS Confed. NHS Confederation, basically. NHS Confederation, NHS Providers, Digital Rewired. I think it's just called Rewired now, I think it is. What's my role in the NHS? So I have a number of hats. So I've been a doctor now for 30 years, right, as a surgeon. So I work as a professor of surgery at the Royal London Hospital, Barts Health, biggest trust in the UK, right? And so I've been there for the last 20 years. Few roles that were interesting. I was clinical procurement lead for the trust, and we procured lots of items and technology over the last 10 years. I sit on the NHS Assembly. The NHS Assembly is a group of 50 people from different parts of the NHS, all parts. And we advise the government on the long-term plan. So I'm part of the NHS Assembly. We have everybody, pharmacists, technologists, different specialties, but everyone's considered. And we have a meeting once a month where we tap into the chief executive of the NHS. So the chief exec, Simon Stevens, when the long-term plan came out, he said, I want a group of people to advise me. So he picked us from different specialties. I'm the only surgeon there. And we used to meet with him once a month, have lots of discussions where he would tap into our brain about what to do in the NHS. And that would become part of the long-term plan. So he's like an advisory body. Yeah, allegedly, maybe. Some. And they move on very quickly. So yeah, I'm connected. And I used to work a lot with Simon Stevens and everybody else at that stage. I don't attend as many meetings as I can because I'm just busy. But yeah, so that's kind of one way of getting in. There's lots of little bodies that kind of do a lot of promotion work and things. Yeah, and so the other thing I do, so I was the college council member 5 years around the International Health and Global Program and Technology Program for them. So I have many, many roles across universities and the NHS. I think it's the NHS Assembly. Having direct link to the chief executive of the NHS is the big one. Because obviously that's, you're right in her ear, Amanda Pritchard, and she listens to us as a group. It's a really good question. I think about it. Obviously, what we say is very closed doors. It's very secret in terms of, obviously, we keep a closed door approach to this. And they share information that no one else knows about. So we have to be very careful about what we can and we can't share from that. But I think it's a network that you have. You have all the chief executives there from many hospitals. So accessing the right people and maneuvering you into the right position. That's all it is. What I've discovered is if you're the right person who can make a decision, or at least help you, rather than just turn the door, yeah, it's that, isn't it? Oh, yes, I will help. Rather than say, no, thank you very much, next. It's, yes, that's great. I think we can help him here, or let's support. It's that support that you need, right? And that's all it is.
What are the biggest shortages that the NHS is trying to resolve? In other words, what is the demand which companies can have?
Good question. Let's at least start. I'll carry on.
Yeah, well, I think the electronic patient records is a big thing. So I mentioned all those 229 NHS trusts. Hardly any of them are all linked up to each other. So I think something around electronic patient records is a huge demand. I think one of the other priorities is the clinical diagnostic centres as well. They're lots of those are coming up at the moment in across England. Mental health awareness as well, and it's a huge. In fact, I saw in a presentation upstairs that it's mental health services which are getting the most funding at the moment as well. And then the third one is elective recovery as well. So obviously the backlog. So those are the four main areas and where the biggest demands are, and actually where most of the funding is going as well.
Yeah. So if you look at the NHS and our challenges, let's put it out there. First of all, it is the elective recovery program. So at the moment, we have 8 million people on the waiting list. 8 million waiting for a procedure of some description. And we're not going to get through that waiting list for another decade at least, if ever. So that's a huge burden. How do you manage all those elective patients waiting for surgery or procedures over the next few years? And that could be post-op recovery, diagnostics, remote monitoring. It might be a waiting list initiative. How do you manage it? All those kind of things that would go along to manage that big waiting list. That's the first one. Workforce shortage, huge workforce shortage. We're 120,000 nurses short and about 30,000 doctors short at the moment, currently. So there's another problem. Smart workforce, automation. How do you help? AI maybe, lots of things. The NHS data, federated data plan, the data platform is now being sorted out with Palantir. Again, that's an opportunity. Okay, so if Palantir, again, responsible for having the data, not controlling, but how allowing access, for example, how do your companies use that data now? Can you come in with solutions? Because they haven't got solutions. They may have the data. How do you now use that data? Because they're going to have to share it with somebody to create solutions. And that's where to get in. It's early. And so you could approach people like Palantir and others say, look, we'd love to get more involved going forward. That might take a year or 18 months down the line, but it's an opportunity. So that's the kind of one of the areas. Data that involves cybersecurity, privacy, etc. AI is big. So you've seen Rishi Sunak have the AI Safety Summit for the first time globally about a month ago. And the NHS has its own AI kind of funding. They pushed out 250 million for AI companies about 3 or 4 years ago. It's come to the NHS. So AI is big for the UK. It must be a global leader in AI. It's funding it, pushing it out. Companies now are being supported with funding to go into the NHS to do either pilots or translate into clinical practice and scale. Another opportunity for companies that are doing amazing work, maybe with LLMs or AI, whatever you decide to do. Yeah. So those that kind of think about what are the pressures we're facing. Okay, it's workforce, huge problem. It's the waiting list, huge problem. It's the data that's coming out now that's a bit chaotic. And also the ICS are rebanding. They're new. They always need support from tech partners because they're just creating new systems in place. Approach them. While they're figuring it out, their structure, can approach them. So can we help in any way? We have always technology partners. What can we help you with? So I always see reconfiguration as an opportunity for other companies. Yeah?
Yeah.
Anything else? Yeah? Yep. Yeah, home care is great. So what they're doing now, they're pushing out remote ward rounds, virtual ward rounds they're called. So during COVID, the chief executive was looking for a solution for remote care. They approached a company called Huma, who are UK-based, and they now have virtual ward rounds, which are now being pushed out widely. So you do ward rounds remotely on a telemedicine platform, you see the patients, you prevent them coming in, for example. That's a big deal. They love to share how the NHS is creating virtual ward rounds across the entire country. So again, that's the opportunity that you have from that perspective. And so they love home care. They love saying, how do we support people at home better? So this is where you think about your wearables, your sensors, etc., monitoring patients. How do we embed ourselves and to keep patients out of hospital in the home? Lee mentioned mental health, unmet demand. Just recently, the Innovate UK put out a big grant, I think 3 million worth of companies building products for mental health. So you need to keep also on track of what comes out from Innovate UK and the tenders that come out through the NHS framework to keep your eyes. One person literally has to sit there every day, every week, say, okay, what's the new tenders that come out? What's the new framework looking at? How do we get involved in that? And you start applying, yeah, with a partner in the UK. Say, can we apply for Innovate UK grant, 50,000, 100,000? But that means you're credible, you've got some money coming in, and you have a partner in the NHS, yeah? So those kind of small things that do help. Oh, net zero, yeah, that's a big. We're just figuring it out. In fact, I talked about net zero this morning, my keynote. We like to think we're ahead of the game, but we're not. A lot of interest. So we wrote a sustainability paper at the RCS of surgeons, and now we've been introducing a checklist for theatre to do. But when you do an operating list, you go through a whole checklist around sustainability. Are we using single-use only, multi-use, what gas are we using, etc. So, and we did the first net zero surgical operation in Birmingham earlier this year, a net zero surgical operation. So we're very interested. The government clearly is keen. So there's an opportunity there as well. Okay, so can we bring you ideas for net zero? In fact, one of the companies that came in last year here, it's the OR, and they recirculate some of the energy and warmth, so it's recyclable. And they came in, and now they're in the NHS, for example, because they're early to adoption. I'd say that's an opportunity. If you've got net zero opportunity or a solution, people are now listening. Yep, they'll invest. Top-down approach. So great, let's try this out. So I think that's a real opportunity. If the NHS now, politically, is going for net zero by 2050, if Rishi Sunak and the government are saying we want to support net zero opportunities, and the capital investment available as well, it's a win-win-win. So if you have those solutions, wherever they are, now's the time to approach the ICS, the NHS, wherever we discussed it before, and bring those into the equation. In fact, in that framework I discussed earlier, through the government, if you have those companies doing, we do the stuff for climate change and support net zero, then actually you're going to be one of the very few companies now in that framework already. So it's again opportunity. So just think about how you get that in there, yeah?
And that's translating on the ground as well, within the ICSs, within the trust as well. So any business case that's written now, if there's nothing in there about the green plan or sustainability, it gets bounced back to you. You need to make sure whatever it is that we're implementing has an acknowledgement of that. Also as well, we talked about the competitive tenders, when one of the questions now in the tender review is about sustainability in the green plan as well. So like Shafi mentioned, it's going to get more and more, and it's going to increase.
They'll have a checklist. They'll say, right, you're coming in, we do this, is net zero positive, is it equality diversity initiative? And they have a tick box exercise. Have we ticked all the boxes? Yeah, so it's going to become part and parcel of a tendering process, right? Yes.
Actually, it struck me at the conference that lots of the startups that are already that have pilots or are working with a few trusts are working with particular specialties, maybe a particular clinical lead or even a particular clinic to try out their startup. And from the trust side, I've seen trusts struggling with trying to kind of rationalise the tech that they bring in
Yeah.
and trying to get a stronger grip over what's coming in. But I kind of haven't seen that at this conference. If you were a new technology, you wanted to start off in the NHS, would you recommend trying to find a kind of innovative clinical leader who wants to bring your tech into their clinic, or should companies be going to central tech leaders who are trying to own it?
Yeah, good question. So you always have the enthusiasts, the local clinical champion, right? Who think, oh, it's a great idea, let me introduce it. They help you navigate through a single system, a single hospital. The ethics, the governance, the kind of the research protocol, whatever it is, right? They'll help you do that as a small project and a pilot. The problem with the NHS is so divided almost, in the sense that you might bring it to one place, say, okay, let's bring it to another place. So, well, I've got to order again. Where's the governance, where's the ethics, and so it becomes fragmented. So it's good for a small project to showcase, hey, we've done this in this hospital, it's useful. How do you scale that? That's one of the questions. So I think that's where the kind of the NHS Digital Health London, NHS Innovation Accelerator, and the HSNs play a part. Because their role is to bring you to much wider configuration. So the HSNs will say, okay, we'll bring you to our partnership hospitals. Yeah, so if you want to bring an idea, we will help you, support you through the regulation, through the ethical process, bring the patients, and give you access to not just a few thousand patients, but HSN might be 2, 3, 5 million patients. Yeah, so I'd go for those areas where immediately you have much more support through research validation and access to a larger cohort of patients and support. Yeah, that's what I would do. Clinical champions are great, but they're limited. Yeah, and a lot of people say, hey, we've got this great guy, he's going to do this for us. But yeah, but what's next? That person won't be able to send it elsewhere and scale your company or bring you reimbursement, right? It was a small project that's a proof of concept, which is okay for a lot of people.
So you mentioned a little bit on the shortage of qualified professionals.
Yep.
So what are the strategies that being adopted, number one? Number two, you have some solutions in that space. In particular, when it comes to the validation of demonstrated competency of the staff that is being brought in.
Yeah.
If you were to try to approach something like that, who would you work with? What would be the recommendation?
So depending what you're trying to bring in, are you bringing staff from other places? No. So you
Just the technology and processes for actually validating the actual performance of a nurse, let's say, at the bedside rather than passing a knowledge test. So the difference is...
clinical competence, right?
Right. So the difference is asking your pilot to explain to you how to fly the airplane versus actually flying it.
Yeah, yeah, sure.
There is a huge difference between that.
Yeah, yeah. Good question. So I guess the question now is, okay, is this about clinical competence? Is it about improving skills, or at least addressing that, etc.? So again, I think this is one where you need a system-wide approach. So the ICS would be the perfect opportunity now, because obviously that's a whole system approach that you're trying to improve, or entire hospital, for example. The HSN might be an idea, and they have access to, again, a large cohort of patients and a number of hospital system. I'd say at that level would be the right approach, because you're trying to show real change in nursing or competencies, improving outcomes, right? Which is great. Difficult to quantify, difficult to remunerate and reimburse. That's the different question, okay? So that's the question I would ask.
Everybody will agree that we need to
100%.
Care, but
Yeah.
being able to actually, like you said, put a number to what
Yeah,
it
yeah.
means.
And so most health systems are very short-termism. If you show short-term improvement, they'll throw money at you. Long-term, they're not interested, right? Because the government's only here for 4 years and they're out the door, right? So that's the problem we have with the short-termism. So you've got to somehow show improve very quickly in terms of modelling. This is the advantage as you go forward, and then you have a chance, right?
That is the challenge indeed, because
Yeah.
these programs, the improvement really is long-term.
Yeah, it is,
all
yeah.
of them.
Yes,
And
100%.
People are willing to look at it that way and to invest.
Very, very few. There are some. You have to find the right people, of course. But I'd say once you show the proof of concept and demo, if you've got data already that you've acquired already, well, that's even more powerful. We've got all this data. So if you come at that level and you're much higher level, rather than early startup, we've got all this massive data, show the improvement and competence, we'll be interested, 100%. That's something that they would look at.
Just to comment then, so was it 4.2 million bed days were lost by falls in wards in hospitals? You link the competency to that, reduced to 4 days. Right, that's an instant win.
Yeah.
Right, that's the third biggest on the NHS list at the moment.
Oh, is that right? I didn't know that.
So you link it to something that is practical,
Yep.
that is a ward level structure, so you can get a matron on board that can put it through an ICS. Or
Yeah.
put it through
Yeah.
something else. Right, that's your instance.
It's a good idea. Yep.
Thank you.
It's okay. Yes.
Going back on the net zero topic, do you require a certification or some kind of validation? So how do you classify whether one product or service is net zero?
Actually, I don't know that. Do you know?
Yeah, no, I don't know.
We had the whole net zero conference yesterday, actually. We had a whole day on net zero. And shame we didn't ask them that same question. We had John Groom, who's the head of kind of private hospital chain as a net zero champion, or the director of net zero. Also, in one of the largest trusts that I work in, he's a net zero kind of person. He's the right person to ask. I can give you his details, but he'd be the right person to contact around certification. I don't know the answer.
Yeah, but if you list the service and you say, okay, my service is green and I'm
Hmm.
net zero, I don't know. Yeah, I can say, okay, big.
Yeah. There must be a process, I imagine. I haven't seen it.
accreditation, yeah.
The same as the corporate world.
Okay.
It's an ESG standard.
Yeah.
You can just show some evidence
Okay.
on specific.
Okay. I haven't
So
seen that.
if you'll be Corp registered,
Ah, okay, sure.
certified,
It's a good question.
We put a net zero service,
Certificate, yeah, whatever it is.
you put some AI thing.
Net zero AI, ChatGPT, you know, you're winning, right? Throw all the technologies, yeah, into the equation. Yeah, yeah. Yeah, no, it's true. They like those keywords, right? You throw those words. Because we have a VR company now. We've added AI-powered XR. Suddenly everyone's interested, right? But it's just XR. It's good. And AI and LLMs and ChatGPT, etc. Suddenly become very valuable, right? It's playing the game, isn't it? Any other questions? I can share my details with all of you, and then just get in contact. And then if I can, I'll then. Is there one person in charge of all this, or is it all separate here?
Yes. Yes.
One person would be helpful rather than 50 people. Okay. If one person can get in touch with me, I can share the details of people that we've discussed today. That might be able to help you. Certainly the Crown Commercial Service. That's key. I think that's really an easy win for you guys, right? Yeah. Crown Commercial. Yeah, I'll introduce you to him. He was here yesterday. He was going around looking for companies, actually. Really interesting. Yeah. No, sadly not. So if one person can share that details with me or contact, ask me what you need, I can send that back to you as you wish. You can scan my badge. Presumably, yes, I do. Do you want to scan my badge, guys? If it's 50 emails, no. But if it's one from the Bulgarian contingency, of course I will.
otherwise we'll have Barry chase you.
Barry would chasing me, yeah.
So does it mean that if we need to contact you, we need to contact you through the Bulgarian British Chamber? Or
No, through this, whoever this group is, right? I'm not sure. Whoever wants to contact me, I'm happy. I'm on LinkedIn, so if you're on LinkedIn, just add me and we can share conversations and stuff. I do a lot of share stuff on social media. Yeah, but do email me for those, and I'll email you Amri first of all, and anything else you need to access. Yeah. Okay, good. So we'll see you at Webbit next year, right? Dr. Plamen Rusif?
You're coming?
I come every year. I've been going every year since 2016. Yeah, Plam and I are really good friends. We've been friends for a long time. In fact, he invited me to COP28 just now. He had a conference at COP28, and this week I gave a keynote for him on Sunday virtually. Yeah, he had a side show with Her Highness, who runs the UICC, which is a climate change organization. So yeah, so I've been to Bulgaria at least 6 times now in Bulgaria. Yeah, yeah. I'm part of the family in Sofia. Yeah, I've been there all the time. Yeah. If I've got a picture with your president, I met your president last time, and the president before. I have his phone number. He texts me. Yeah, but no, I have him actually on my WhatsApp, which is really interesting. I show my son. I said, Bulgarian president. I'm not proud. I'm not proud. Only in my son's eyes, okay? You're funny guys.
I play football with a friend who's Bulgarian.
Oh,
That's as far as I go. He's a top guy.
Okay, guys, thank you. All right.
Thank you.
And we'll help you as we can. We're here to help you and support you, make it easier. It's hard to navigate. Just use us, okay? Thank you.
Thank you.